My name is Professor Duncan McLaren. I'm a consultant clinical oncologist here in Edinburgh and specialise in genitourinary cancers. So I do radiation treatment, but also systemic drug treatment for mainly prostate cancer and bladder cancer. And in the past, I treated an awful lot of kidney cancers, but pretty much all prostate cancer these days. I was always drawn to prostate cancer because of how important a cancer it is. Majority of male cancer is something that's been undertreated really in many respects. But prostate cancer is our commonest male cancer. It's the largest cause of cancer death now in the UK from cancer for men. So I always felt it was a very important disease to get involved in. So the PACE-B study was testing 5 fractions of prostate stereotactic body radiotherapy against either 20 fractions of external beam radiotherapy or even up to 37 fractions of external beam, or 39 fractions actually of external beam radiotherapy. And the aim of the study was to show that the 5 fractions were as well tolerated as standard radiotherapy and that the PSA control at 5 years was not inferior, i.e. it was just as good. So over the years, publications have come out from that study, and it's shown that generally speaking, it's well tolerated, the side effects are comparable, but importantly, the 5-year PSA control is the same with the standard radiotherapy, either 4 weeks or nearly 8 weeks versus doing it in 5 days of treatment. Really a huge advantage to men that you can now reduce the number of fractions down to only 5. Much more convenient, less travel, less disruption being from home, and obviously more convenient for departments. You're only having to treat over 5 days or 5 treatments rather than nearly 8 weeks worth, which was obviously quite a burden. So the Precision study is a study that we've written a protocol for here in Edinburgh, and I felt that you could improve SBRT radiotherapy by reducing the number of doses down to only 3, but it was also going to optimize the use of the RayPilot HypoCath system. So we've been using the HypoCath within the printout study. And we always felt that with the weekend break, the Monday and the Tuesday, men were quite ready to have the catheter taken out. They've been in for 7 days. So every day that you leave it in for, slightly more risk of infections, just general inconvenience for a patient. So we were very impressed with obviously how accurate we could deliver that radiotherapy, and then understanding through printout that the urethral dose could be reduced because you can see the urethra, because the catheter is lying in the urethra, meant that we were starting to see less toxicity around the bladder irritation. So Precision came about trying to do really optimization of the radiotherapy to make it even more convenient for men, take it from 5 doses of radiation down to 3, and to deliver those doses every day. So the patient would be treated, say, on a Tuesday, Wednesday, and a Thursday, and they would only have their HypoCath in for just 2 nights, which is really very minimal inconvenience for a patient. And I felt that we could deliver that because of the accuracy that the system was bringing, but it was really going to optimize prostate SBRT, trying to push the boundary a little bit further, because really with PACE-B, I think we're just at the starting point of where we can go. So it's been a big effort to get a protocol written and get it through ethics. It is now open to a large number of centres across the world, both America and Europe, and also in the UK. It's a protocol where we're going to recruit 100 patients, and the idea is that their toxicity should be no worse than the PACE-B study. So we basically pick the doses to say, right, in terms of cancer control, should be no different, but also in terms of side effects, at the very least, it should not be worse than PACE-B. But we believe that with the urethral sparing that we've introduced into that protocol, and the fact we've cut margins even tighter around the prostate, because we're confident that we don't need to have a wider margin, which was used in PACE-B, because we're tracking the tumour motion throughout radiotherapy, that the side effects should be lower on the bowel as well. So we're hoping that we'll see a distinct improvement in terms of the side effect profile and the tumour control with 3 fractions.